Welcome, everybody. I think without further ado, we're going to make a start because we know that this webinar is quite tight for time, but welcome all of you who have joined and to this recording actually, which we hope will be a really important and useful resource. But thank you for joining our Exploring Your Development, a conversation with UWE webinar. So the webinar today is hosted by SWAG Cancer Alliance. My name is Libby Potter and I am a Cancer Education and Practice Development Lead for the ACCEND programme at North Bristol Trust. So I'm really delighted to chair this session alongside Lena Haythornthwaite, who is SWAG's lead for the ACCEND programme in the Cancer Alliance. The webinar is, designed really to hopefully give you a clear insight into some of the key cancer postgraduate modules and programmes that are available at UWE, how they'll support you in your professional development, how they'll build and how they align and relate to building your capabilities in practice with the ACCEND framework, and kind of what to expect from studying at this level and what that involves. So what we'll give you today in the next hour is a chance to hear directly from the programme and module leaders. They're going to share their expertise, be able to answer any questions so that you can make some sort of informed choices about any next steps. So it's really great to have you with us today. So just a few housekeeping bits. Can you write your name and your role in the chat, please? I know it might say Q&A at the top, but if we can keep to using the chat today, that would be fantastic. If you can very kindly keep all microphones except those who are speaking on mute. As I say, we are recording this webinar, so just to give everyone advance warning of that. And that's obviously because we want everyone to be able to watch this afterwards who can't attend. And the webinar will be available on the SWAG Cancer Alliance website. So how will things run today? So we will be inviting each of our guests today to briefly introduce themselves and share information about their modules, the programme. Each has about 7 minutes and then we'll move to a Q&A panel. Can I ask also, as well as adding your name and your role in the chat, if you can add any questions into the chat, if possible, who that question is directed to, that would be fantastic. And if it's an open question to all the panel, that's also absolutely fine. Lena is going to be monitoring the chat and can keep an eye on things. But when we come to the Q&A panel, obviously as well, we welcome you to put your hands up, raise your hand, and gladly take questions from the floor too. So without further ado, I'm going to ask Lena just to pop up, if you can, the order of the programme, just so that we can have a quick glance at that to remind you of who our speakers are today. We're going to be beginning with Julie Armoogum, and then we're going to be moving on to hear from Louise Brown, from Dorothy House, and then we're going to be inviting Clive, who many of you may know, to talk about Professional Development Awards, and particularly also look at really essential modules such as the Evidence in Work-Based Learning module or the EWBL. Tom will be talking about the management of head and neck cancer. And then we've got a really great opportunity to hear from Amanda, who's undertaking the MSc in Professional Development, who's undertaken modules such as the EWBL, just to hear about that lived experience, and then moving to that Q&A. So, as I say, without further ado, I'm now going to introduce our first speaker, who is Dr. Julie Armoogum, who's a Macmillan Senior Lecturer at UWE. Thank you, Julie.
Okay. Hi, lovely. Thanks, Libby. Hi, everyone. I hope you can see my slides. Give me a shout. I can't see your faces anymore, so give me a shout if you can't see them. Hi, as Libby said, I'm Julie Armoogum. I'm a cancer nurse by background and a Macmillan Senior Lecturer at UWE. I'm going to be talking to you about a couple of modules and programmes that we've got that are very linked to the ACCEND programme. So, and I'm just going to give you a little bit of a history of those programs and those modules, because some people on the call may have studied at UWE before and are wondering where the current changes are. So I'm just going to give you a little bit of history. So as everyone I'm sure knows, back in 2021, the Aspirant Cancer Career and Education Development Programme called ACCEND was created, and in the Southwest we had a really big impact on that and involvement in that development of that programme right from the beginning. So you can all feel that your voices have been heard in this programme right from the beginning. And that came from really big dreams. We had really big dreams to enable people to have a clear pathway for their professional development and have clear educational goals and aspirations at the different stages, from pre-registration, enhanced, advanced, consultant level. And what I'm going to be talking to you about today really feeds into that, and these programs have been designed for those different levels of practice. So the ACCEND framework was published in 2023. In same year, it was included in the NHS long-term workforce plan. They ACCEND tendered for some universities to host some PG Cert in cancer care and a clinical leadership module, and UWE were fortunate enough to secure that contract. So we've been able to run these courses. We ran it for the first time last year. They're continuing this academic year and well into next year. And we're all delighted. Everybody involved with ACCEND is absolutely delighted that it was in the National Cancer Plan that was published last week, which shows that the government has got a real commitment to continuing and extending this programme. So the work that we're talking about now is really politically current, and it really is hopefully going to have an impact on both your professional levels and also our cancer services. So the two programmes I'm going to be talking to you about is the PG Cert in Cancer Care and the Clinical Leadership in Professional Development and Cancer Care. I tried to find a nice acronym for that, and unfortunately we haven't. So I'll just shorten it to Clinical Leadership, but the full title is Clinical Leadership and Professional Development in Cancer Care. And these modules has been designed specifically to align with the knowledge and capabilities in the ACCEND framework. So each of our learning outcomes align directly with the framework, and the assessment processes are linked directly to those capabilities in practice within the framework. So everybody that comes through these modules should be able to evidence their achievement and attainment of those capabilities in practice. So hopefully these modules will really help both the individual and clinical practice to track the progression of their staff. And just to let you all know, these modules are currently funded by NHS England for 25-26, so that's this academic year, and into next academic year, which is 26-27. So that means that the NHS England is paying for all the fees, so that the student or their workplace won't be liable for any of those fees. They're supported by the programme. So the PG Cert in Cancer Care, this is a full postgraduate certificate in cancer care, which involves 3 modules. And the modules are the fundamentals of cancer care, which is a 20 credit module. It's a blended module between university and studying from home, and it runs in September, and the students are asked to do a poster and a presentation and a question and answer session for their assignment. Then we also have, running along the whole side of the programme, an evidencing work-based module, which Clive will be talking to you about in more detail later. But for this programme, it's a 20 credit module, and it's aligned directly with achieving those capabilities in practice. And students have to do a self-assessment of the capabilities in practice, decide which ones they're going to achieve during the process of the module, and work with clinical practice to achieve and evidence those capabilities in practice, and then write a critical reflection on their learning. The third module is a communication skills in supportive and end-of-life care. Now this module happens at Dorothy House Hospice in Winsley. So it's a face-to-face module in the hospice environment. I know we're going to hear a bit more about this module later on, so I won't say too much, but feedback is always that this is a very special module to be involved in. So all in all, there's 3 modules, which takes up 60 credits. We ran it for the first time last year, and based on feedback, we have changed it slightly and we've extended the programme. So now you can do it over 2 years, because some students said that doing 3 modules in 12 months was quite a lot, both for them personally with all of the other things they've got going on, but also for their workplaces. So now we can do it over 2 years. And also we've extended the length of EWBL to cover the whole programme. So students have got longer to work with clinical practice to achieve those capabilities in practice. Also, just to be of note that might be interesting to people either on this call or listening to the recorded webinar, if you've studied at UWE or elsewhere previously about any of this, particularly the fundamentals of cancer care module. So at UWE previously, that's been called the nature and treatment of cancer or the principles of cancer care. If you've studied for that module previously, you're able to transfer your credit into this programme, so you wouldn't need to repeat that module. If you haven't studied at UWE, but you've studied elsewhere, a comparative module, you would need to just match up the learning outcomes from what you've studied to the fundamentals of cancer care. But it's very possible that you could transfer your credit that you've already got in. There's no expiry date to that credit. So if you've done something in the past, it's very likely that you'd be able to have that included in the programme. And equally for the communication skills, if you've done a communication skills module, either with us at UWE or elsewhere, it's possible that you can transfer that credit in. At the moment, with how things stand with the evidence-based learning module, it's unlikely that you'd be able to transfer credit in just because it's directly aligned to the ACCEND programme. But the current cohort, if you're interested, we've got places. We'd absolutely love you to have you in the programme, and you can start in March to do the communications module. So the current options are start in March 26 to do the communications module, and then you would do the fundamentals of cancer care and the EWBL next academic year in September, October, or you can wait until September and start at the beginning of the academic year. You're welcome at any point. We've got funded places, so please do get in touch. Now, the next photo I've got is that this could be you. This programme is will result in a graduation, because you're going to leave with a full recognised qualification, a PD cert in cancer care. So this was our first cohort that went through the programme last year at their graduation in November, which was an absolutely fabulous celebration. We've been evaluating the programme quite heavily because it's a pilot study. It's the first time we've run it. And these are comments that people said 6 months later. So after they've been back in practice for 6 months and they reflected on the learning and the impact it's had, people still saying it's the most enjoyable and useful programme that they've done. It has enabled them to improve as a practitioner, and it's been invaluable to them. And as I was saying, we've got funded places available and we'd really welcome you. So please get in touch to join us on the programme. We've also run a module called, am I doing okay for time, Libby?
Probably just got another minute. Sorry,
Sure.
Julie.
Okay, sure. I'll just talk quickly then about the clinical leadership and professional development in cancer care. This is the 30 credit module at level 7, which is master's level. It runs once a year in October, and it's run jointly by us at UWE and the facilitators from the experts from the Skills for Health, which really brings in a new dimension of thinking about business cases, thinking about leadership. And within that, we've got a Cancer Leader seminar series where experts from across the country come and share their leadership journey. And again, you can see some comments from students who completed this module where they really found that it helped them consolidate their leadership skills. They found it invaluable to practice, and it helped improve their confidence. So I'll finish up there, and I'm happy to take any questions at the end of the session. Thank you so much, everyone.
Julie, that's amazing. Thank you so much. And so amazing, really, to hear that there's both spaces available and also that it's fully funded, which is absolutely fantastic. Thank you. And as I say, please do add any questions into the chat. It'd be good to get to see some questions going in there. So I'll now invite Louise Brown to tell us a little bit more about the communication skills in supportive and palliative and end-of-life care module.
Yes, thank you. So hello, my name's Louise. I co-run with Dr. Julie Taylor the communications module on this course, and we run it face-to-face because really you need to run it face-to-face for communication skills. I've got a few slides which I will just share with you. Oh, here we go. We won't start on slide 4, we'll start on slide 1. So this is the module. We've been running a communications module at Dorothy House for a while. It was really exciting to be asked to be part of the ACCEND and the Cancer Care programme. Why should it be part of this PG cert? I think because communication is what we need. Communication underpins everything we do, every contact we have in healthcare. Communication makes that run smoothly or not. And a lot of the evidence shows that actually, unfortunately, it doesn't always run smoothly. The research keeps showing that communication skills are an emerging need. Well, that was how the latest report was phrased, and I thought, well, it's been emerging for quite a few years now, so yeah, nice that they still think it's new, but it isn't. This module is really valuable. We have some comments at the end that I'll show you. People they come very nervous, but they really enjoy it. We look at all sorts of things. We explore personal preference, personal communication styles, how that influences the way you interact with people. And then we explore how you can tweak that, change that, whether you need to consider different ways of doing things. And you get lots of opportunities. This is a very sort of experiential course where you get lots of opportunities to practice those skills, leading right up to a final kind of video analysis of a practical conversation from your work in practice. Lots of nerves, but generally by the end of the session, everybody is really on board. We run it at Dorothy House. It's 5 days back to back here. It's quite intense. You do get quite tired, but people do get a lot out of it. And running it in the hospice it's a really nice, peaceful environment. It gives people an opportunity to step away from their workplace, experience something different. This is a photo of our grounds, which in nice weather you can share with us. And explore what communication means to you, how it works in your roles, what its importance is, and how important it is both for you as a professional to feel satisfied with your communication, as well as your patients and the people you come into contact with, to understand what you're trying to say to them and how it improves patient satisfaction. It's run by a whole team of us, myself, the physio, we have a nurse, and we have a psychotherapist involved as well. We look a lot at grief and bereavement and how bad news affects processing of the brain in terms of taking on communication. So it's quite an in-depth and theoretical module as well as the practical bits. You have a written assignment at the end, and you record and analyze a conversation from practice. It takes up a bit of time, so we do encourage everybody to get started early on it, but these are some of the comments that people have made, and they do really seem to get a lot out of it when we meet them again, and we have met them again afterwards. So yeah, we'd love to see anybody who wants to join, and if there are places, that would be lovely to see you in March. We're really looking forward to the next run. Thank you.
Thank you so much, Louise. I really appreciate that. And Clive, you have just a little bit more time now, actually. Just maybe 1 minute more. That's all.
Excellent. Right, let's share some stuff then. So hi, everybody. My name's Clive Warn. I'm two things for the purposes of this session. One is I'm module lead for EWBL, which is our evidence in work-based learning modules. And I'd want to talk a bit more about that during this session this afternoon. But I'm also the program lead for our pathway, which leads to a Master's in Professional Development. So I know a lot of you will be interested in that. Some of you may have completed that or be on that journey. So I'll talk a bit about that pathway. I think I will share some information about that award first, I think. So I've just put some, can you see that? I've just put an information flyer up and I'm just going to talk to it really. Essentially, I'm going to talk about the Masters in Professional Development, and the Masters in Professional Development will allow you to build your own award. So essentially you are spending your time planning what you will study, how you will study it, and you will then build an award based on your experience, based on your aspirations, or something that you are currently doing in practice and you want to hone in on that area of practice and focus in on it. So many people will be working in the field of cancer and will build an award that comprises several cancer support modules, leadership, research, and the masters will always culminate with a 40-credit work-based learning module. So it is bespoke. It's a bespoke award. It's bespoke to you as an individual. And what I would want to say about it is, in relation to the Masters Award, you will need 180 credits. That's what you're aiming to build in order to achieve a Masters. Within that, you can bring in up to 120 credits from previous study. So that's really important and it's quite unique on this award. So if, for instance, you've done Julie's postgraduate certificate in cancer care, and you might have done some previous study around, I don't know, supporting students in practice, leadership, research, anything, you can build that credit into this award up to a maximum of 120 credits. That includes modules from other universities. So the modules or the previous study does not have to be UWE study. It can be study from any other university, either in the UK or overseas, as long as there is an equivalence to the credit in the UK. And we've got a process to establish that. So it's very flexible. It allows you to come at any stage of your career, essentially, and start to look at where you've been, what you've done in your career to date, and where you want to go, and what you plan to build going forwards to complete that Masters Award. So we work with you, I will work with you, we have a conversation about your plan, and we create a way forwards. That gets approved. It's a contract between you and UWE. It has some flexibility in it. If you feel like you need to change the modules that you'd planned to do, you can do that at any point. It just is a process of negotiation. As I say, the only compulsory module in all of this is the work-based learning module, and I'll talk a little bit about that as we go along. There's no age limit to the credit that you import. So if the credit is still relevant to your role and your practice now, so even if you studied it 15, 20 years ago, if it's still relevant now, it's still relevant and to be used towards your Masters. So you can use that credit. There's no time limit when you're on the award. So that's another important feature. You can join the award next week. You can take as long as you need to complete the award. So you can work at your pace based on your work, your role, your work-life balance. So there is no kind of pressure that you've got to complete within a certain time frame. So that kind of makes it very useful when you're working in busy professional lives. The other thing I haven't mentioned, but you must understand about the award, and is quite unique again to this award, is that you can bring in up to 60 credits from previous degrees. So if you've got a degree that's given you your qualification, or you've studied a degree in the past to BA or BSc level, then we will use 60 credits from there towards that 120 that you can use in this award, in the Masters Award. So many of you will already find yourself in a position where you've got a degree possibly from your pre-qualifying studies. You can already use 60 credits of that. You already have 60 credits towards this Masters. Okay, it's a lot to take in. So there's some information here. There's some links in here. There's a link to the PD email system, so you can always email PD if you want to initiate the conversation. I'm sure that my contact details will be available at the end of today's session. You're more than welcome to contact me about this award, and we can have a conversation. Also note that every Tuesday and Wednesday you can log into my booking system and just book a 15-minute call with me, and we can have a conversation about possibilities for you as an individual. So I'm very happy to do that. I think that's all I'll say about the PD award. So I'll stop sharing that. And then I'll share something about work-based learning. So work-based learning module is the compulsory module on the Masters in Professional Development. You'll also see, if I can find it, there it is. You will also see that it forms part of Julie's postgraduate certificate in cancer care as a module, a compulsory module in that award as well. And it also forms part of several awards across the university. But for the purposes of today, that we'll look at kind of what it is and what it sets out to do. So let's start slideshow. So essentially, work-based learning, evidencing work-based learning is about work being the curriculum. Work is the place of learning. All the learning is centered around the work. It can be defined as an educational opportunity that you're already engaged in. These are things that you're doing day to day in your practice, projects that you may be involved in, improvements that you might be involved in or leading on, ideas or proposals that you've kind of had milling around in your head for a long time and you want to do something with it. Well, EWBL gives you an opportunity to give you some structure around that and some support around that so that you can create improvement in your workplace. Essentially, it's about an active process of learning. So it's very self-directed. You are the project lead. This is your learning. We will work with you to enable that learning to happen and for that improvement to take place. So I've said it's self-directed. Everything happens in the workplace. You will meet with your supervisor. So you're given an academic supervisor at the beginning of your project. Your supervisor will work with you on a monthly basis and meet with you online as your critical friend, as your support, as somebody who's going to talk you through the process, enable you and facilitate the process with you so that it's the most effective and efficient way to get your project underway and to get the results that you're looking for. It's always going to involve literature and evidence. It's always going to be supported by academic supervision. It's always going to have an impact in your workplace. So it's very much about your day-to-day work. And you have a lot of flexibility in this. So you get to choose what your project will be. You design your project. We will help you with that. You design what that learning will look like. And you also design how you might be assessed. So we will work with you to look at the best fit for the assessment for your particular experience on work-based learning. It might be a project report, it might be a presentation, it might be a portfolio of evidence, a combination of things. These are some examples of projects. This is the good stuff that's always useful to see. So this is the kind of things that people do for work-based learning. So evaluating roles or practice or interventions that have been around for a while, and you want to just step off and take a look back at what you've done and see how effective it's been. It could involve, or it could be an audit or some sort of data collection where you are looking at what you know already and making some judgment around what you know already and what you might do with what you find. It might be scoping or looking around and seeing what's needed, or you've had that niggling sense of there being an issue or something that needs improving. Well, this is an opportunity to do something about that. It may involve actual implementation of change, so making a difference, designing what that change might look like, using, for example, a PDSA framework, and then going ahead and doing it with academic supervision. It might be comparing practices. You'll be needing to look at your networks and at the literature. Has this been done somewhere else? And if it has, what can you learn from that? Rather than reinventing the wheel, what can you take back to your workplace and implement rather than needing to start from scratch? It might be about consolidating your learning and your own personal learning and journey in your career or your own development. It always involves criticality. It may involve developing competency or demonstrating competency. Evaluation skills are certainly going to be part of it, but it always centres around service and quality improvement.
Clive,
So these are just some key points.
Sorry to talk over you, Clive. I might need you to wrap up in a minute if that's all right. Sorry.
No problem. So these are the key points. I'll leave these there. These will be provided at the end of the session. And that is the end of my session anyway. So thanks, Libby.
Oh, sorry, Clive. I didn't mean you to wrap up quite as quickly as that, but that's very kind of you. Thank you. Brilliant explanation of the Professional Development Award and EWBL in less than 8 minutes. So well achieved. So I'll just introduce you now to Tom Cave, Senior Lecturer in Habilitation, and he's going to talk to us about the management of head and neck cancer. Thank you.
Thanks, Libby. So I'm a senior lecturer in rehab, as you mentioned. I'm a physio by background. I've worked in cancer care for over 10 years and moved to teach full-time from 2023. Before I talk about this module, just might be of relevance to some of you. I've been enrolled in the MSc Professional Development since about 2017, I think. So be confident that there is no time limit. You can just keep plugging away at little modules here and there. And I'm in the final stages of completing my EWBL dissertation, which is an interesting opportunity to explore aspects of my current role. And I thoroughly recommend it to lots of you. Okay, so I run the Management of Head and Neck Cancer CPD module. It is make sure I'm moving forward through my slides. It's a multidisciplinary, holistic focused module to explore the lived experience of those with head and neck cancer and how the team fit together. I've got a few different module learning outcomes, so it's probably relevant just to let you know what they are. So we're aiming for students to be able to critically evaluate the contemporary approaches to diagnosis, treatment, modalities, and symptom management in head and neck cancer. We're also maybe thinking a little bit about being able to show some critical understanding of the psychosocial dimensions in head and neck cancer, thinking about the emotional impact, thinking about rehabilitation, survivorship, and palliative care strategies. And we're looking for you to show an ability to critically appraise your current service provision and the MDT pathways, and identify areas for potential innovation or improvement in your clinical practice. This all maps to the ACCEND framework that Julie has worked so hard on. This little presentation, I've talked about me. I'm half of the module leadership team. The other half is Jo Greedy, who some of you may know, who's a head and neck cancer specialist nurse based down in Musgrove Park, but also has a role in the Barno head and neck cancer organisation. We split our module up into 3 learning blocks. We're starting with face-to-face 2 days this year, delivered at Glenside campus. It gives the opportunity for individuals to network in person whilst meeting some of the team of external lecturers that we've got coming in. So this year we're getting an overview of practice from James Constable, who's a head and neck cancer surgeon based up in Gloucestershire. We've got systemic therapy delivered by Matt Beasley at UHBW, and we're having a session on altered airways. There's a bit more practicality to some of these sessions, so hence it's useful to do in person. Our day 2 is looking more at reconstructive surgery and restorative dentistry. We've also got some input from a speech and language therapist, again bringing in some hands-on experience and getting a feel of the different sorts of equipment that might be necessary for managing these type of patients. And we've got a panel of patient experts with lived experience to come in and share their journey with us. We switched to online for day 3 and day 4, where we explore psychology, dental hygiene, and start thinking about palliative and supportive care, as well as acute radiotherapy side effects. Day 4 tends to be a bit more food focused, and we've got input from dietitian, gastroscopy, CNS, and an alcohol liaison nurse as well, particularly relevant for the population of head and neck cancer patients. We round off the day with just an overview of the pathway from Joe to make sure that people are understanding how we want that to fall in line with the module learning outcomes. And our final 2 days explore maybe some of the late effects of radiotherapy, physiotherapy across the pathway from prehab all the way through to rehabilitation. We're thinking about diagnostic imaging, so we've got a radiologist coming to talk to us. We've got specific session based upon thyroid cancers from student feedback. They'd like a little bit more on that, so we're trying to build up that particular aspect of the module. And then our final day is looking at communication and swallow, pathophysiology and lymphedema management.
Tom, I'm so sorry to hurry you again, but
That's all right.
No, I do apologise, but I wonder if you might just be able to wrap it up in a minute. Is that okay?
Yeah,
Thank you so much.
You do a project. It's a bit like an EWBL project, really helpful for quality improvement. And we give you a lot of support here at UWE to help you to complete that through the library, through the module team, and through different online learning outcomes. This is just an example of the sort of pages that you might be able to access. This has got a little QR code. You might need to blow your screen up to be able to see it, but that gives you all the module information. And that's me done. Thanks, everyone.
Perfect, Tom. Thank you so much. Another amazing module that I know has been running for a number of years now, so that's fantastic. Thank you. So finally, we're going to hear from Amanda Portal, who is ACCEND Practice Education Facilitator at UHBW. Thanks, Amanda.
I assume my screen's just shared, has it?
Yes, it has.
Yes, lovely.
Perfectly.
Yeah, so hi, Libby's already introduced me. I'm going to zoom through this so that we've got time for questions at the end. I'm just going to talk briefly about my sort of lived experience of doing the Professional Development Award, and in particular the EWBL. I'd done 2 master's modules. I'd done Leadership and Innovation, and then I'd done Julie's Clinical Leadership course when I found out about the Professional Development Award. And as I could import credits from my original degree, it just made sense really to go for it. And as Clive said, as part of that, you have to do the 40 credit EWBL. And it's really overwhelming. I'm not going to lie. No one tells you what to do. It's very sort of self-directed. But as Clive said, you do get an academic supervisor. They are there to help support and guide you, although it still has to be very much led by you. But I met with my supervisor sort of once every month. I was given a really generous study day allowance from my manager, which really helped. I naively thought I wouldn't need all those days, but I certainly did. I've also had colleagues doing EWBLs at the same time, which really, really helps, just having that peer support, because otherwise it just can feel a bit lonely. One of the biggest challenges I found was actually writing the learning contract. You're basically kind of writing your own marking scheme, and it's really difficult to get your head round when you've been used to being given assignment titles. My advice is choose something and choose the topic that you're really interested in that's really going to help either you or your service develop. You're going to be writing 8,000 words, so you really need to enjoy it. From a previous course, I touched slightly on the transition from a clinical role to a leadership role, so I knew that I really wanted to delve more into that. And I also looked at the implementation of capability frameworks. So the main bulk of my work was a literature review and a critical reflection. Loved the reading, loved the reflecting, but I did really struggle with the academic writing, and yeah, it did push me over the edge, as you can see there. Didn't struggle with the word count at all. 8,000 words was actually surprisingly easy, but just really struggled sort of writing it to that master's level. My advice for anyone doing it is be organised, keep that momentum really going. I did work consistently on it for a period of around 6 months. By the end, as I said, I was quite on the edge, thinking that it wasn't good enough. It is a stress, you're juggling it with your work and family. But when you get that pass, it is all worth it. And Prosecco has never tasted so good. So yeah, it's the sense of achievement is amazing. Just to achieve those 40 credits is just, yeah, it's worth all the hard work. I learned loads about myself, loads about leadership. And I enjoyed it so much that I'm doing my final 30 credits with another EWBL. So, and there we go.
Thank you very much. And you're living proof that we can survive, but not only survive, but thrive doing these amazing modules. Thank you, Amanda, living proof. Yeah, Clive, please do come in.
I'm sorry, I omitted to mention about the Macmillan version of EWBL, but I also wanted to say thanks to Tom and to Amanda for just sharing the lived experience, because that's always the most important bit, really. Can I just very briefly mention the Macmillan version of EWBL?
Fine. Please
so
do.
We do have a funded EWBL module that runs twice a year in May, June, and also again in October. And this is funded by Macmillan Cancer Support. So it's part of a national collaboration that we have with Macmillan. There are 14 funded places on each of those runs. And this is a 30 credit work-based learning module that operates slightly differently in that you meet as a group. So it's a group supervision module. You meet with a team of supervisors once a month over a period of about 5 to 6 months. And you work on a project that's related to cancer support. So you don't necessarily have to be working in that field. Most of the places are reserved for Macmillan professionals, but there are places on each run for non-Macmillan professionals. And really the criteria is that your project relates in some way to cancer support. And as I say, it's fully funded. Many students that use that will go on and top up that 30 credits at the time that they're on that module to do 40 credits, which then ticks the box for the compulsory module for the masters. So they then use that towards their masters. So it's a really important module. It's a really successful module. It's something we've run with Macmillan for a long, long time now. There are some hugely wonderful outputs from all of our EWBL students. Particularly, you know, for the context of today, from the Macmillan students who go on to do, you know, national projects and be involved in national stuff. There's publication that comes from it. People present at conference from these modules. So the possibilities are fairly endless. So certainly talk to me about the Macmillan EWBL if that would be of interest to you. Thank you, Libby.
No, thank you very much, Clive. And actually, we've finished really beautifully on time. So thank you to all our speakers. That's been fantastic. And we're just going to open up now for our sort of any questions. I think we've had a few in the chat, Lena. Have we got any that we need to cover? I think people have been very kindly answering them. So thank you for that. But Lena, anything that we want to put to our panel, please? I think you're on mute.
There, lovely. So there is one question from Alison Lovett-Turner about masters sounding great, but as it isn't in line with the ACP masters pathway, if you're looking for this, would you have to complete another MSc or not? I don't know who would be able to answer that. Clive, please.
Yeah, I'm quite happy to answer that. So no, it isn't aligned to, you don't automatically credential with ACP. So we're talking about advanced clinical practice. So it is there is a separate masters if you wanted to do that. That is what we call a linear masters. So it has a series of modules that you must take if you want the masters in advanced clinical practice. However, you can always do this Masters, the Masters in Professional Development, and you can use that and credential yourself. So there is an option to do that once you've achieved this Masters. So no, to answer your question, you don't have to repeat a Masters. There is a way to credential once you've completed this Masters in Professional Development. But to know that there is another Masters that sits at UWE, Advanced Practice, and that does automatically credential you.
I have another question here for you, Clive, as well. This is from Hannah Easton. What would you need to do if you've done an EVBL module a few years ago, but only the 30 credit version?
Okay, so the 30 credit wouldn't be enough credit to meet the requirement for the compulsory module. So you would have to do another 40 credit EWBL module to meet the requirement for the Masters. That said, that 30 credits that you've done in the past can be used in your plan for that maximum 120 credits that you can bring into the award. So for example, if you've got a degree, you've got 60 credits. If you've got the EWBL from the past at 30, that gives you 90 credits already towards the 180 credits needed for the Masters. And if you've got any other modules up to that 120 threshold, you can bring those in as well, leaving you with just 60 left to do. Of the 60 credits left to do, if you met the maximum 120 credits, 40 credits would need to be evidencing work-based learning. The other 20 credits is your choice. It can be any module at UWE, including another 20 credit EWBL if you wanted.
Lovely. Then there is one quick question from Alison regarding the CLBDCC course, the leadership one, that how long does the 30 credit run over? How many months does it take to do?
Okay, so as things currently stand, it starts in October. It contains 6 face-to-face or online study days that run between the October and the February. Also, there's 2 integrated practice days where students organise their own placement or activities so that they can help really expand their professional networks and achieve those capabilities in practice. But so those 2 integrated practice days, they're not set in the university, but they're really crucial placement days for the students. And there's a self-directed study day. Then assignments are due in March, April time.
Lovely. And I think there was also from one of our lead cancer nurses, Hannah Little, had put in a chat that I gathered the patients were involved in developing some of the content and would love to know more if possible.
Yeah, lovely. Thanks, Hannah. That's a really lovely question. Thanks for prompting me about that. Yes, they were. When we were developing the programme, we set up a group of patients and stakeholders to really think how creatively we could meet the learning outcomes from the ACCEND programme. So the patients, we went with the learning outcomes to that group because the learning outcomes were have been set by the ACCEND framework. So we went with the set learning outcomes and we really discussed how we could meet those learning outcomes in a way that the patients felt were important. What things did they think was important that the workforce needed to know and how to achieve those learning outcomes? So they helped us design some of the simulation activities that people do, and they helped us develop some of the teaching sessions, and in some of the modules those patients come in and share their experiences and talk with healthcare professionals. So yeah, they were really involved, and that was in the development of the module. And then this year we've brought them back to talk about the evaluations that students have given and to think about how we can change things, what we can, and how things we can making sure that our content is ultimately relevant to the people that have got cancer and their families, so that we're keeping that at the heart of what we're doing, really. So yeah, thanks, Hannah, for reminding me we did that.
And there is another one question for Clive. I don't know if you can see it in a chat, Clive, but there is Clive, do you mean via the online portfolio to get the ACP badge? As I do not think this pathway will continue. I have APP masters already and have looked at it, but I'm asking for those at the start of their pathways. I do not want to start people on a pathway that isn't in line with their goals.
I'm literally typing away there trying to respond to it, so I've got the opportunity to do it now. Alison is absolutely right. So you can credential at the end. You can do that at the end of any master's pathway. But if you're wanting to do the ACP, you really should look at doing that route. There is an APEL process on that. So if you do have some credits you've already done elsewhere, another university or at UWE, there is an option to bring in some of that credit and APEL it. So when I say APEL, there's a process that you apply for where UWE will look at what you've done previously and make a judgment about whether it fits or doesn't fit and whether you need to make some do some additional learning to be able to join the ACP program. But you're right, if ACP is your thing and that's where you want to go, that's where you need to start, and you need to look at the Masters in ACP. Many ACPs, though, do use the Masters in Professional Development because they are some way down their career path and have done most of, if not all of the required modules, want to complete the Masters in Professional Development and then have gone on to credential afterwards. So that's the answer to that one.
Thank you very much. I can't see any other questions there. If I have missed anybody, please put your hand up. And also our speakers will have a look at afterwards the chat as well. So if we've missed any, we will. There is another one from Amanda Morse who is asking, I'm currently on the Leadership and Professional Development Cancer Care. Such a valuable course, highly recommend. Lovely comment there. Thanks, Mandy.
Lena, can I just come in? I had a question that was put to me this morning, actually, to ask for somebody who couldn't attend. And well, actually, there were two questions, actually. One was about the communications course, actually, Louise. This might be directed to you, if that's okay. It was really about what's involved. You know, we heard that there's some time spent at Dorothy House, but there's always the worry about role play sometimes for people. And just wondering, again, we've talked about simulation, about what's involved there. And I've heard that from other people that can be both challenging, but actually really, really worthwhile in terms of just understanding a bit more about how we present ourselves, the way we communicate and things like that. So can you tell us just a little bit more about that?
Yes, so we build up to it. So we do kind of games and exercises at the beginning, the first sort of 3 days. On the 4th day, we do a video conversation. We've worked up a conversation. Everybody brings a scenario from practice, a conversation that didn't go well, something they want to explore. And then we they think about the things they've learned over the time, how those might change the way they approach that conversation or answer that question, and they role play it with another member of the group. And there is often a lot of nerves at the beginning, but by the time that actually arrives, we tend to find the group has created a really safe space. Everybody is feeling supported and comfortable in talking in front of each other, and the camera is just another thing in the room. It's a real group and team event, and people get a lot out of it. Yes, they find it really valuable. So yes, it seems really scary, but on the day, everybody enjoys it. You know, they get a lot out of it.
Fantastic. That's really reassuring to hear, actually, and how you build up to something like that and feeling secure and safe to be able to do something like that when you're exposing yourself.
Yeah, it's really important.
Thank you.
To feel safe.
Thank you very much. And I suppose this was for all of you. This was another question that was asked for me. Kind of what are the success factors? You know, and this is maybe for everyone. You know, what's the difference between maybe pass and fail, or Amanda said about choosing something you really love. That's going to be a really key ingredient for success. But I was just wondering, you know, from Tom and everyone really, could you choose one thing that you would say would be great to do before you get started? You know, think about this and kind of get yourself sorted in that way. That would be really great. I know Amanda said choose something you love, but Amanda, if you've got anything else, or anyone else. Yeah, Louise.
I think time management.
Okay, yeah.
Plan it out really well, especially with the communication module, where you have to provide a transcript from a recorded conversation. So you do need to plan that in plenty of time.
Okay, that's really good advice. Thank you. And Tom?
Along the same theme, use your Outlook diary and block the time. And that's a commitment from you to yourself to actually do it. And it means that people can't book in other meetings. So just helps you to actually take the time, because it is resource heavy in terms of your thinking time and reading time and all that sort of thing.
Thank you. So I suppose that's also that thing about just being really organised, maybe, you know, time management, valuing that time, you know, making that protected time from whatever, whatever sources might pinch away at that time. But thank you. Clive, yeah.
Yeah, I mean, it's to echo that, really. I mean, I know I say, oh, it's wonderful and you can do all this stuff with your work, and, you know, it has direct impact on your work with work-based learning modules. But as Tom and others, Amanda and several others in the room will attest, you also need time to be able to think about what you're doing, to step away from your practice, to think critically about what's being done, to explore alternative ways of doing things, so that you develop as an individual, and you don't just repeat the same things that you've seen that may or may not have worked in the past. So it's an investment in yourself as well as an investment in your workplace. And I think that's really important. And we'll support you, your supervisor will support you to carve out that time and meet on a regular basis.
Brilliant. I love that investment in yourself. Absolutely. Yeah, Amanda, your thoughts?
Yeah, I was just going to say, make most of the use of the support and resources that are out there, really. UWE's got a brilliant library with loads of resources. I know my UHBW, the library there, has just got brilliant resources about writing academically, doing literature searches, all that kind of stuff. So yeah, just really tap into all that support that's available.
Yeah, thank you. That's really helpful as well. Thank you, Amanda. And Julie, your sort of final words on this, really.
Yeah. I suppose that was just to echo really what Amanda was saying, and Clive there, about it's a lot of this is directed, it's going to be directed by you. It's your study, it's your time to take that time for you to learn and develop. But also remember that you're going to be working with a team of lecturers and support staff at the university who are really used to juggling multiple professional roles ourselves. We're coming with that experience, and everybody's here to support you in that. None of these programs are set to trip you up. They're all here to support and develop you, and recognizing that the challenges that most people are coming to when they come to do CPD, that they're coming from practice, and actually those to really engage in things like the assignment support sessions that are set up for people. Sometimes students can feel quite intimidated by those, but actually those sessions are there as a supportive, non-judgmental set of circumstances to really help you work through your assignments and thinking about how you might engage with your work. So kind of really embrace that rather than try to feel that that's there to intimidate. It's really here to support you. We've all been in the shoes of working clinically and studying, and similarly now juggling lots of professional hats. So we, the whole team are really here to support and guide you in that.
Thank you. That's absolutely brilliant. And I think, to be honest, that's a great way to end our webinar today. I don't think there's any more questions, Lena, are there? No. Okay, so I just want to take the time to thank every single one of our speakers today. You've done an incredible job of relaying really key information about the wonderful courses and modules and programs that you deliver at UWE, and giving us some real, nuggets of really core kind of advice and guidance on how to navigate our ways through this. So we really appreciate your time, really appreciate the time of everyone who's joined us on this webinar. As we say, we are recording it. This will be on the SWAG Cancer Alliance, so I hope website, so hopefully it'll be a really good resource for people to tap into in the future. So I wish everyone a very good rest of the day, and yeah, please do remember that we're all here to help and support you in your learning and development. So thank you so much to everybody.